Um, I'm going to talk a little bit about vitamin K food uh, for people who are on warfarin as a platinum medication for certain medical conditions, DVTs, like different thrombosis, plaques, or pulmonary embolism like PE, or uh, AFib, atrial fibrillation. So for those people who have to take warfarin, most of people who have AFib um, and need to take the warfarin because they have certain condition like mechanical heart failure in their body. So how concerned about the vitamin K food uh, to warfarin and other oral anticoagulants like Alaclix, uh, Geralto, or Bedaxa. So vitamin K does not affect other oral medication like Geralto, Alaclix, or Bedaxa. It does affect warfarin. So when you go to Google and you type vitamin K foods and warfarin, you know, you can find some information about vitamin K food, what food contain vitamin K, and some foods contain more vitamin K, some food has less vitamin K. Visual, on Google, usually they have all the common questions like people also ask when you concerned about vitamin K and warfarin. So some questions like, can you eat foods with vitamin K and warfarin? What foods should be avoided when taking warfarin? What vegetables are okay with warfarin? The vitamin K uh, raise your iron level. So these just some most common question when people concerned about vitamin K when they are on warfarin. So in, in general, uh, in general, um, you should not stop vitamin K food completely when you're on warfarin. Because if you stop completely, it's not healthy. Stop vegetables completely or stop greens completely. Uh, you should eat some vitamin K, which is found in vegetables. So you should eat some greens. But you need to be consistent with your vegetables. You should eat same amount of vitamin K or same amount of greens every day to make sure your uh, warfarin stable in your body. You have to eat consistent. You need to know how to measure your vitamin K, for example, spinach or kale contain a lot of vitamin K. So uh, if you eat, I would recommend that you should eat low to moderate amount of vitamin K. So if you eat half of a raw spinach for one day, the next day you should eat like 2 or 3 cups of raw cucumbers or tomatoes like that. But dark leafy vegetables or dark leafy greens contain more vitamin K, like kale, spinach. Light vegetables contain less vitamin K, like cucumber or tomatoes contain much less vegetable, less vitamin K. So I would recommend that you should eat low to moderate amount of vitamin K, but you must be consistent every day to make sure that your warfarin stable in stabilize in your body. Generally, when you see this question, can you eat food with vitamin K on warfarin? Yes, I would say yes. You can eat some food with vitamin K, but you must be consistent and you should know how to measure the amount of vitamin K in each food in order to make sure you eat a similar amount every day. What foods should be avoided when taking warfarin? Well, uh, I don't think that you need to avoid any foods when you're on warfarin, especially the food affect your warfarin like greens or vegetable. But some foods, may um, affect your bleeding, like garlic uh, or some other herbals. It may increase your iron, so it may increase your bleeding. So may uh, try to avoid those medication may cause bleeding. The vitamin K uh, does not increase your iron level or does not raise your iron level. It decrease or it lower your iron level. So what it means when it's low iron level? So when your iron low, you are at increased risk of blood clot. When your iron level is high or critical, is increased risk of bleeding. That is why you have to make sure your iron are stable and in the range. Um, there are two typical range. One, the normal range for certain medical condition like uh, DVT, AFib, the normal range between 2 and 3 for the INR. For mechanical heart failure, the INR level is between 2.5 to 3.5. So it's depend on medical condition. You have a different INR range. You have any further question on this topic or the issue? Please let me know in the comment below. Thank you.